Welcome to The Dental Brief, the podcast that delivers actionable insights and expert strategies to help dental professionals like you grow, lead, and succeed. I'm your host, Patrick Shavasty, the president of Omni Premier Marketing. Every week at The Dental Brief, we bring you real conversations from expert speakers that offer expert advice and quick tips that make a real difference in practices nationwide. Whether you're a general dentist or run a multi-location practice, we've got you covered with content that's designed to help you attract more patients, to streamline your operations, reduce headaches in managing your practice, and increase your profitability. If you're ready to elevate your practice, be sure to subscribe, hit the notifications bell, and let's dive into today's episode of The Dental Brief. Hello, everyone. Welcome to another episode of The Dental Brief. I'm excited. Always excited when a guest is a dentist that's coming on to share with other dentists to help them learn and grow in their practices. Dr. Shervin Molayem, say hello.
Hi, everyone.
Great to have you here. Like I said, thanks for taking the time to share. We've got some pretty cool stuff that we're going to talk about today. Going to get into AI, but this is going to be the first guest that I've had on that's talking about AI from a treatment planning point of view. I've talked to some guests that are working on AI that insurance companies are probably going to be using to potentially not approve cases. Maybe they're going to use it to approve cases. Who knows? But you're certainly going to help patients buy into getting the treatment that they need. So let's start. Tell us, how'd you become a dentist? How'd you get into dentistry?
Yeah, so my grandfather was a dentist and my uncle. So it was just kind of I was going to be a doctor, but then I had their influence, became a dentist. Been practicing for 15 years in Southern California as a periodontist. And got into research during the COVID time, investing and advising for a lot of dental technology companies. A lot of them are actually in AI space, in the detection though, and being able to see, in radiographs, which is really the first thing that gets changed with dental AI as far as dentistry that people have seen are dental x-rays detection, which then translates into patient education, right? Well, they can change the color of the caries and make it look red, and patients could really see it and say, okay, I have this cavity, it's this far deep, it was that far deep before, and then create that trust with the patient.
It's awesome. We're going to shift right into Trust Dentistry AI. That's the website that we're going to point you to today. Take a look at that. Talk to me a little bit about AI and how you see AI changing dentistry. Let's start for the better, and then let's talk about maybe for the worse. So actually, let's do it in reverse. So what are some bad things that you could see potentially happening, some negatives of AI in dentistry?
Yeah. So I think the direction of AI in dentistry is going to go as far as the thinking layer, right? So with Trust AI, we have the brain of the office, which is knowing what is going on in everyone's mouth, from their fillings to the diagnosis to what their plan is. And then there's the action layer, which are the robots, right, that come later. And so if this layer is not correct, then the action layer is not correct. So we want to get this right. We want to make sure we don't have this AI hallucinate and create and make up things that aren't there. So we have to make sure that, we program it with safeguards so that doesn't happen. Like I'm sure you've seen with ChatGPT, you could mumble jumble, make things look like it looks real, and then you find out later that one, name didn't belong there at all.
Yeah, so that's definitely happening. And your website, it says real-time clinical decision support, personalized treatment planning, powerful diagnostics capabilities. So let's talk about real-time clinical decision support, that area on the site. What does that look like? How can AI help here? What's it doing?
So instead of what does it look like, let's see what it sounds like.
Yeah.
So we're going to make a phone call right now to Isaac. All right. Are you able to hear? Okay. So Isaac, I'm here with a patient right now, and they have an infection on tooth number 3 that's near the sinus, the pain on chewing. We're thinking that on the CT scan, it looks like it's near the sinus. I'm having some trouble finding out if there's a crack or not. What's your assessment on this case?
Consider performing a thorough clinical examination and possibly a cone beam computed tomography, CBCT, to evaluate the extent of the infection and any potential cracks. Assess the proximity to the sinus and the presence of any sinus involvement. If a crack is suspected but not visible, transillumination or dye tests might help.
Well, let's say it's about 1 centimeter periapical radiolucency and it's near the sinus. Would referring to an endodontist be helpful? Like, what are the chances I need to take out this tooth?
Referring to an endodontist is advisable for a more specialised evaluation, especially given the proximity to the sinus and the size of the radiolucency. The chances of needing extraction depend on the extent of the crack, the tooth's restorability, and the response to endodontic treatment. An endodontist can provide a more definitive prognosis after assessment.
If it's been treated with a root canal before, what are the chances if we do a new root canal or retreat it that this tooth will be savable?
The success of a root canal retreatment largely depends on the initial treatment quality, the presence of any new or persistent infection, and the tooth's structural integrity. Success rates for retreatment can be high, around 70 to 80%, if the tooth is restorable and the infection is well managed. Consulting with an endodontist.
Isaac, could you send me an article that says that 70%? Could you email it to me, please?
I'm searching for current literature on root canal retreatment success rates right now. This will take a few seconds. Please hold on.
And then it's going to email me.
Sure.
So, yeah.
Let me ask you this question as a layman. I know that periodontist, right? You're a specialist. You've done 6,000 plus implants.
It just emailed me the article.
Yeah, it's fascinating. So you've done 6,000 plus implants, highly trained, experienced, right? I think experience matters, doctor. So what did you learn in those circumstances that was outside of your clinical training and your experience?
You mean from this?
That's right, yeah.
Well, one of the things you realize is some of the foundational things that dentists, whether it's 5 years out or 10 years out, they don't know everything. And they all have an inclination towards a specific type of dentistry. Some are really good at surgery, some like orthodontics, some like kids. So you can't know it all. And what this does, it's a thinking partner. So you ask it questions and then you take it from there and you keep asking more and more questions. So by the end, you could be on a 15-minute conversation and you really get to learn from your own case. Now, this is just a general question that I just gave. But the power of it really comes from taking the CT scan and taking the X-ray and taking the period charting and their medical dental history and later on maybe their blood test and having it all analyze it and then being able to give the best plan and find correlations. And then what's cool about it is the patient sees, pull this up with patients in front of them and I talk the case out with them. And when they hear the AI confirm what I'm saying, then they're like, okay, yeah, you're right. This tooth does need to come out.
So let me ask you this question. This has been around for years now, several years now, that AI can literally detect certain types of lung cancer in certain type of patients well before a radiologist can, right? So it can actually detect it before a radiologist is able to detect it using the same imaging. I think that puts a sting right into a lot of experts, right? People who have trained their whole lives, have dedicated so much time to be able to look at an image and go, oh yeah, that's a form of cancer. And now AI can do my job better than I could do my job. There's obviously parts of dentistry that AI is probably never going to replace, or if it does, it's going to be way in the future, right? Actual doing the work. What do you say to that dentist that's saying, hey, no, this is not smarter than my training?
You said something interesting. You said that AI can do my job better than me, but that's not how it should be looked at. It should be looked at that AI is going to allow my job. It's not going to replace jobs as much as people think. It's going to enhance jobs. It's going to make jobs less stressful, quicker, more efficient, and patients benefit. And then the dentists aren't burnt out. So where AI is going, and not just healthcare and everything, it's saving time for everyone. It's going to make people more productive. So you could do with that same time, you could do much more. It's going to bring down costs eventually because things are going to be cheaper. So it's a win-win for as far as getting burnout for dentists and having to do there's a robot coming out soon in a few years. It's going to do a crown prep in 15 minutes. Whether we like it or not, it's happening. And it's still going to need a dentist to numb, and there's a button, foot pedal to push the foot pedal. Look at their eyes as it's doing it. And when, just like, when you see the patient feeling pain, you have to be there. Look at their eyes, stop, take your foot off the pedal, numb some more. It's going to be always an operator behind this. Now,
Sure.
will an office need 5 associates? Maybe they'll need a couple of less if they're, bigger office. They're still going to need, dental assistants. They're still going to need hygienists.
Is there a potential zero net gain here in the sense that, like, for example, there's bots out there that are answering the phones in practices right now, both voice and chat. It's been around for a bit. It's used in a lot of other industries. It's being used in dentistry right now. Let's just say it's great. It's the best thing that ever happened to the phones in the dental office. But every single dentist has it. Where's the advantage for an individual dentist? Isn't that just kind of become a zero net gain, meaning maybe the employee's gone. Now you're paying a software cost. You're paying a cost of bandwidth and AI. But if all the other practices have this, how do you really have an advantage, or how are you going to net more money per hour of work time?
Okay. So there could be an advantage in different ways. One could be if that receptionist has access to the actual patient data and know what's going on, then when they're making an appointment, and that's what we do at Trust AI. Since we have that data, they can say, you know what? I know what's going on in your chart. You had a crown last time. They prepped it. You're here for delivery. And, every time you come in half an hour late. And you take up, instead of 1 hour of time, you take an hour and a half of time.
Sure.
So it already analyzes this and communicates that with the patient that for your particular slot, you need 2 hours and this is where we have it. So that's the advantage. You get better technology of it.
Right.
The other advantage is to go completely the opposite direction and go authentic and basically have a human involved in this too. So the second you feel like someone is getting fluttered or frustrated or whatever, it signals a human, and a human comes. I see you're having trouble. People in this world of AI, what's winning at the end is back to the square one, authenticity. People want to see the real deal sometimes.
Sure.
Actually, they prefer it. So that's what I would say.
So people want to check out, again, your site is trustdentistry.ai. How can they dip their toes in? I see you got try for free.
Yeah. So they go on the website. They easily can register, just put their phone number and their email, and all of a sudden they have access to the most smartest dentist in the world. You can ask it any question, chat or voice, and it's really fun. It's any question you have. We had a contest the other day. If you could make it say a wrong answer, we'll give you $100.
Wow.
And, so we're very confident. We actually programmed it with safeguards and guardrails so that it won't give wrong answers and it won't hallucinate, because it's healthcare. You can't have, a health industry answers being given. And that's hence our name, Trust AI.
Yep.
And we want to also, in general, we want to bring trust more into our profession. I feel that if you look on social media, when there's like a dental procedure and there's layperson looking and commenting, and you'll see, I have my dentist, screwed me. I have, extra cavities that they told me my other dentist. You always read that kind of stuff.
Right.
And I think that if you go to 10 different dentists, there shouldn't be 10 different treatment plans. And there shouldn't be one different treatment plan. But there should be somewhere in the middle. There should be maybe 3, maybe 4.
Right.
And that will bring more trust into the profession.
Yeah.
And when that happens, I think patients will be more comfortable doing treatment, and it's a win-win.
Yep. I think we're in 100% agreement there. Sometimes when a machine says something, people automatically buy into it, whether it's right or wrong. If the Excel sheet kicks out a number, that's the accurate number, right? So people believe that. So I want to invite our listeners to check it out. Go to trustdentistry.ai, scroll down, find try for free, give it a whirl, see what you think. Give us any feedback. Dr. Molayem, thank you so much for coming on and sharing with us today. I appreciate it.
Thank you, Patrick. Thanks for having me.
Thanks for listening to this episode of The Dental Brief. If you found it helpful, give it a thumbs up, subscribe to the channel, and share it with a colleague who could benefit. We're here to help dental professionals like you stay ahead of the curve, one brief episode at a time. You can find more episodes and resources at thedentalbrief.com. You can also join the Growth Minded Dentist community on Facebook. Links are in the description. Until next time, keep learning, keep growing, and thanks for being part of the Dental Brief community.